Hello, my name is Marco Pellegrini. I'm a consultant clinical psychologist. I work for Grey Yarmouth and Waveney Care Group, Norfolk and Suffolk NHS Trust.
Hi, I'm Georgina Coupland. I'm an assistant psychologist working with an LD community team for Norfolk and Suffolk Foundation Trust.
Hello, my name is Amber Ovens. I'm also an assistant psychologist. I work in older people services for Norfolk and Suffolk Foundation Trust.
Today, we're going to talk about principles of psychological first aid for line managers. We will have an introduction where we will discuss the psychological effects of a pandemic, and we will talk about what psychological first aid is and what are its components, why we use it, how we can possibly help using the principles to help people and our colleagues, responses and reactions, some practical skills, and how to respond to situations where we think the colleagues might be most vulnerable. And there is a list at the end with the references. Talking about the effects of a pandemic, we have to say that healthcare workers are especially exposed to the psychological effects of a pandemic. And you will see in this slide that it talks about frontline staff. We have to clarify that in reality, all staff that participate in the healthcare business are exposed and should be considered frontline. So this includes admin staff, porters, housekeeping, catering, all the people that are participating. Why is it that healthcare workers are more exposed to the psychological effects of a pandemic? Because they are dealing with the effects of a pandemic in itself, and there is ample research showing how a pandemic affects all of us psychologically. And because as healthcare workers, they have additional exposure to the effects of a pandemic. For what concerns the general effects of a pandemic, the effects that affect everybody, one example is quarantine. And we have experienced that in the UK until now, a measure known as lockdown. Lockdown is effectively a form of quarantine. And this is known to have long-lasting psychological effects. The other issue that tend to affect us when there is a pandemic and when there are restrictions like a lockdown, like a quarantine, is that our perception of risk in relation to the origin of the pandemic, the pathogen, the virus, is increased. So the same virus that was around before there was a quarantine, before there were restrictive measures, is now perceived as more dangerous because the government has said that we cannot leave our house. And that's a natural reaction to feel more fear for the same pathogen that was around before. The other interesting thing to consider is what is known as the behavioral immune system. When there is a pandemic, so when there is a pathogen, a virus, what happens is that we switch into a more kind of instinctive mode where we become much more careful and wary about who we mix up with, who is around us, who we meet and who we spend time with. And these responses are emotionally related to a sense of fear, to disgust. So we are more likely to be triggered by what we perceive as possibly increasing our chances to get the pathogen, to get the virus. Unfortunately, that makes us more vulnerable to prejudice than it normally happens, because the instinctive response is that we become more protective of our environment and we become more fearful of including in our circle people that we see as strangers. It's not unusual, for instance, that during pandemics, behaviors like racial prejudice goes up. And this is not said to justify racism in any possible way, but it is something to take into account, because it means that minorities, ethnic minorities, can be even more vulnerable during a pandemic, also because of that. The other component of a reaction to a pandemic that can have psychological effects is linked to the media, newspapers, TV, radio, and internet now that provides a lot of information to people. It is not unusual during pandemics that media portray things in a sensational way, fear-mongering, emotional headlines. All these things tend to increase the sense of danger. What happens specifically to healthcare workers is that they will be exposed to dealing with the pandemic, but also to be seen in the eyes of the public as the ones that are more likely to get and to carry the virus. So on the one hand, this has led to people expressing their gratitude to people working in the NHS. On the other hand, it can increase the risk that people working in the NHS are seen as the ones that can be more contagious, basically. And it's not just that, because often what we've seen in other pandemics is that the healthcare workers themselves can end up being more careful about who they meet, about restarting their social life, continuing some social avoidance and some avoidance behaviors, because they might feel more responsible and more fearful of transmitting the virus to others. So all this information is really aimed to normalize the reactions to a pandemic. So all we said so far are reactions that are normal during a pandemic. And unfortunately, the effects of the pandemic can be in the long run also psychological distress, like anxiety, depression, post-traumatic stress disorder. But it can be a protective factor, knowing that during a pandemic, we will experience more extreme reactions, and reactions like the ones we described so far.
So we're now going to talk a little bit more about the effects of a pandemic. So more specifically, the responses that people might experience. So as mentioned previously, there are many different responses to a pandemic. Everyone will have some worries and or concerns about COVID-19. Some might feel overwhelmed, confused. Others might be slightly detached from what's happening. And all of these responses are perfectly normal in the current situation. These responses might also be displayed in more physical symptoms, such as headaches, shaking, feeling very tired, loss of appetite, crying, insomnia, nightmares, and anger. And so these are things to look out not only in yourself, but also in your colleagues. So the way that someone reacts to a pandemic can depend on many different factors, including but not only limited to these. So their previous experience of distressing events, the support they have in their life, the more social support they have, the less affected they may be, physical health, personal history and mental health problems, their cultural background, like Marco just said, people from ethnic minorities might suffer from more stigmatization, and age and gender can also play a role in how someone might react to the current pandemic. So what is psychological first aid? Well, the official World Health Organization definition is a humane, supportive and flexible response to a fellow human being who is suffering during or after crises or emergencies like the current COVID-19 pandemic. In more plain terms, this means any assistance given to someone who is suffering psychologically because of a crisis, with the aim to preserve, protect and prevent their psychological well-being from worsening. So psychological first aid consists of a set of skills that are based around rescue and recovery and aims to prevent the development of post-traumatic stress disorder. So post-traumatic stress disorder is a psychological condition that carries very distressing symptoms such as nightmares, flashbacks, and even intrusive thoughts. It can also cause changes to one's mood and also to behaviour, leading people to avoid places, people, and situations linked to the traumatic event. So psychological first aid works by providing practical care and support, helping to address basic needs, connecting people to information, services, and social support, comforting people and helping them to feel calm, reducing distress, and then protecting them from further harm. So it's really important to note that psychological first aid carries many similarities with physical first aid. So firstly, it's not something that everyone will need, only those who are struggling. It's also an immediate response and not a complete treatment. Therefore, just as how physical first aid does not include surgery, psychological first aid does not include in-depth counselling or psychotherapy. In addition to this, just like physical first aid, it's not something that only qualified professionals can do. Moreover, because it's not a complete treatment, there may be areas that you can't assist in, so it's important to know and understand your remit. So, psychological first aid can be carried out on both children and adults, but the key point is it should only be carried out on those who are suffering and should not be forced upon everyone. It also needs to be individualised to people and their needs. Psychological first aid should be used as soon as possible and to be continued during and after the crisis. It can also be used wherever, but ideally in a more private area for confidentiality and respect for the person's dignity, and an area that is safe for both you and for the person that you are helping. So I'll now pass you over to Georgina, who will talk to you about the components of psychological first aid.
Thanks, Amber. So there are 3 basic action principles of psychological first aid, and these are look, listen, and link. So these are action principles to help guide how you view and safely enter into a crisis situation, approach those in need of care, and support colleagues in order to understand their needs and to link them with the most practical support and information. So look, so when we enter into a situation such as in this pandemic and also during our daily work, it's really important that we consciously look at what's happening around us. Situations can change really rapidly. From when you enter into a situation or an environment, it might be a lot different from what you've learned beforehand. So it's important that we take the time, even if it's just a few moments, to look around before carrying out any care or support to others. These moments, or just quick scans, give you a chance to be calm and be safe and to think before you then act. So in this table, there are some key components of things to look for down the left side. And then across the top, there are some questions to consider and some important messages to bear in mind when you look around your situation. So the questions posed are usually snap judgments we make, and some of these we make subconsciously, but the way in which we answer those questions based on what we see around us determines how we then care for each other. I just want to bring your attention to the bottom left to the distress reactions. So you might have witnessed patients, colleagues, or even friends reacting in various ways to distress, and these reactions don't always look the same for everyone, and that's okay. So you might see patients and colleagues suffering from anxiety, irritability, becoming withdrawn, or even physical symptoms such as a loss of appetite. These strong emotions can be adaptive, and our body reacts in this way in order to protect us. So these strong emotions ensure that we carry on with our job for as long as we need to keep going. Listen. So this is the second principle. Listening might seem very basic, but Amber will discuss a little bit more about active listening further on. But listening properly to others is essential to understand their situation and their needs, but also to help them to feel calm and to be able to offer the most appropriate help. Something the World Health Organization says on this is to give the person your undivided attention and truly hearing their concerns by showing care and respect. So in this table or grid, there's just some ideas or a bit of a framework of how best to use your listening skills effectively. So across the top, there are 3 functions of listening effectively to patients, colleagues, or whoever is in need. So if you need to pause this video to look through these bullet points, I'd advise you to do so. And the last aim is a link. So the aim of Link is to help people to help themselves to regain control over their situation. So people might not be able to access their usual supports. So linking people with the right practical support is a major part of psychological first aid. I'm just going to give you a couple of contextual examples just so you can see how basic these might be. So these can include being able to contact a loved one from either hospital as a patient or as a colleague, contacting a family member to let them know that you're safe. As staff, also being given the correct information to be able to carry out your job safely and to ensure that you are aware of certain policies or procedures, and making sure that if you aren't aware of them, that a colleague can then signpost you to that correct information. I'm now going to pass you back over to Amber.
Okay, so why do we use psychological first aid? Well, psychological first aid has been used during other outbreaks such as SARS and Ebola, as well as other disasters such as the typhoon in the Philippines and also after the Haiti earthquake. And all of these situations, it's shown to be the most effective tool. So any initial response to a traumatic event needs to be supportive, practical, and empathetic. So psychological first aid covers all of these points whilst also demonstrating its effectiveness across many different crisis situations, hence why we use it in today's situation. So I'll now pass you over to Marco.
Thank you. We're going to talk a little bit more about how we can help using the principles of psychological first aid. I would like to start from talking about a model that has been put together by the British Psychological Society in terms of a stepped psychological response. The reason why I'm talking about this model is that it can help understanding where your help, our help, is going to make an impact. There are different layers and different ways that we can help colleagues during a pandemic. The bottom one, which is also the foundation one, is the basic needs and the physical resources. There is a level that is about information, and partly we're covering that in this video today. There is a level which is about support and psychological first aid, and there is a top layer which comes in the picture usually later on, which is about psychological intervention. Starting from the first one, the basic needs and physical resources, things that are important to consider are that staff feel that they are safe, and for instance, that they have the right equipment, PPE, and other things that they need to keep safe, that they are helped to get food supplies, especially when they work long hours, long shifts, that there is access to food and drinks in their workplace, that there are designated break areas, and also that they are encouraged to take breaks, that our colleagues get the opportunity to get enough sleep, or checking that they are getting any sleep, because they might be stressed or they might be overworking, they might find it difficult to rest. And also that they have opportunity to contact their families and to show them that they are safe. The second layer of this model that is showed as a pyramid here is the information. This means that we can use psychological first aid principles, which is the main aim of this video. It means that we can share, or we can discuss, or we can be aware of the psychological effects of a pandemic, as we discussed at the beginning. It means also that our colleagues have information on psychological well-being and coping skills that can be done in different ways. Towards the end, we will have a discussion about the resources that are online, but there are resources available through well-being services and probably accessible within the teams or through the teams that people are working in. There needs to be opportunities for our colleagues to discuss in an open and frank way, in a briefing form, what is happening in terms of what is going on with each other, checking in. A good model that can be used is the one of the safety huddles that is quite extensively used in inpatient mental health areas. and it comes from a model called the safe words. The other important thing is that there is an easy way to communicate between employees and management, staff and management. And by easy, I mean that it's easy to give feedback to the management. It's also easy to get a response back. It's also important that staff receive very clear information about what they might face, what is likely to happen to them during the pandemic in terms of how their work is going to change, or their work is going to look like, what's going to be the challenges during the outbreak of the pandemic. And also, it is important to support our colleagues in accessing reputable information on the pandemic, on the COVID-19 in this situation, but also to have them maybe limiting the amount they spend getting informed on the pandemic, because there is a general tendency to get more information than usual, and also the media can be quite skewed towards talking about the pandemic all the time. The next layer is the support and psychological first aid. This means a few things. Well, first of all, it's important that we allow typical and normal ways for people to support each other, ways that are already consolidating within the teams. That's what I mean by normal. Normal in the sense that typically our colleagues support each other that way anyway. So if there is a supervision system in place, if there is a budding system in place, or simply if our colleagues are used to encourage each other over having a coffee or over having lunch together. It's also important to consider other opportunities. For instance, budding less experienced staff with more experienced colleagues, rotating staff between higher and lower stress function, monitoring the support that staff need during the crisis, because that will change over the time. We're going to talk about that in a short while. Role modeling is really important, especially for leaders. Visible and compassionate leadership. Visible leadership is more than being physically visible, is being easily accessible and giving feedback in a way that is timely, but also in a way that staff know fairly well how the feedback is coming back. Compassionate leadership is sometimes easier said than done. Managers are under a lot of stress and pressure, and they can have lots of tasks that are conflicting. One of the best advice that is given about compassionate leadership is actually starting from being self-compassionate. So starting from looking after ourselves as managers, because if we role model that, it's easier to come across as a compassionate leader. It's also important to be able to identify colleagues that might be more vulnerable and proactively support them. We will talk about that in the video. Using a low threshold when we think that they need to be supported, but also non-mandating psychological interventions, because that can be very counterproductive when people are in crisis. Normalizing responses, so not pathologizing the reactions to the pandemic. Creating ways for our colleagues to manage end of life care for patients and services in a dignified way involving family. That can be a protective factor for our colleagues psychologically. Offering guidance for care in the context of the limitations, so acknowledging there are organizational limitations. And also discussing and encouraging innovative systems for relative and staff and for relative and patients to communicate. We've mentioned this before, but I cannot emphasize this enough, because there's research showing that the more patients are able to connect with their families, and the more our colleagues are able to connect with their families and show that they are safe, the better this works as a protective factor for their psychological well-being. And also access to resources for psychological well-being. We will talk a little bit about that as well. The top layer, the psychological interventions, very much depends on what is on offer. And there might be things changing over the time in a national, local picture. But what we know so far is that there are established routes to refer employees and colleagues through occupational health or through GP. Wellbeing services can even be accessed directly. It's quite important to know when to identify the more support is needed in psychological first aid, and we will talk a little bit about that. It's also quite important to try to support motivation in receiving help, because people that work in the healthcare professions can feel they can find it difficult to receive help. So the others aspect to consider, apart from in addition to where the help is going to make an impact, is when our help is going to make an impact. This is because typically in a pandemic we face different phases. There is a preparation phase, and at the time this video was recorded, we're way past the preparation phase. This is when we are preparing for a pandemic, so there's a lot of anxiety about it. There are lots of plans that are made, contingency plans, longer term plans. Then there is an active phase, and I would say that we are still in the active phase at the moment when we're recording this video. Usually the beginning of the active phase is when people are actively, proactively and tirelessly working to resolve problems. And this entails that people will go the extra mile, even further than what they normally do. There'll be a lot of coming together and trying to resolve problems and trying to take care of patients or service users and families. The longer the active phase is going to last, the more likely is that disillusionment and exhaustion start kicking in, because there's just so much that people can give really without starting feeling the psychological effects. This is where it is more likely that people start feeling psychologically affected. And after the active phase, there is the so-called recovery phase. This is when the pandemic is over, things are going back to normal. This is actually a very delicate phase where healthcare workers can start experiencing the psychological effects a bit more importantly. So it's really important to monitor that phase to see if there are colleagues and people that we are responsible for that might need help or more help than what is being provided so far.
So on this slide, we kind of provide you with some strategies and information that aim to reduce stress and promote coping. So ongoing emergency situations can be really disorientating and often really overwhelming, which can compromise our ability to cope with problems. So on the left-hand side, we've got some helpful ways of coping. So these can include things like using coping mechanisms that have worked well. Think creatively about how you can adapt them and then use them in your current situation. Make a plan for coping with social isolation. Set and maintain a normal schedule. Get enough rest, enough nutrition, and enough exercise. You can also take part in online support and community groups. It's also really important that we use humour during this time. Focus on something practical that will help you right now. Understand that people cope in different ways to stress, and they might be more short-tempered than usual. Pay attention to the reactions and behaviours of children, and also help young people to understand that the adults might also be behaving slightly differently. There are also some unhelpful ways of coping. And these behaviours can be seen as understandable responses, especially as we're all overwhelmed, but these can also lead to further long-term problems. So spending large amounts of time watching news and news broadcasts about the pandemic has already been mentioned. A loss of structure in the day, so timetabling is great. Using alcohol and substance misuse, withdrawing from friends or family, overeating or undereating, blaming yourself or others, and resorting to excessive levels of aggression or aggressive behaviours.
Okay, so on this slide, there are a few things about how to respond if someone is experiencing any distress from the current situation. So there, on the right-hand side, are things that are best to do when responding and things that are not really advised. But I'll start on the left-hand side and talk first of all about the good communication. So it's important to remain calm and show understanding, as this can help people in a distress situation feel more safe and secure. And this leads on nicely to the second point, which is active listening. So active listening is a complete engagement and trying to understand the whole message that somebody is conveying without any distraction. So this can be done through both verbal signs of engagement and also non-verbal signs of engagement. So some of the verbal signs can include things like repeating back what they've just said or asking up follow-up questions, defining terms to promote clarity, don't interrupt them, not rushing to fill silences, and often giving feedback as well can be quite beneficial. Some of the non-verbal sort of skills of engagement include things like nodding, eye contact, facial expressions, and gestures. So your non-verbal signs of engagement can often say more than your verbal cues. So make sure that you're aware of the expressions and make sure that you're making eye contact. So again, this follows on nicely to the next point about body language, facial expressions, and eye contact, which are all gestures of communication and are really important to keep in mind when you are helping someone who's in distress. Finally, be yourself, be genuine, and be sincere in offering your help to an individual. So I'll just draw your attention over to the table on the right-hand side of this slide, which has things that are best to do when responding and things that are not advised to do. So I'll start with the things that are really, really great. So keeping things confidential, actively listening and showing engagement, being patient and calm, providing factual information. So if you're not sure, just signpost or ask for help from a colleague or another professional. Be honest, allow for silence, be friendly and be yourself. So on the other hand, things that are not really advised to do, so don't pressure someone into telling you their story, don't interrupt or rush them, don't touch a person if it's not necessary or appropriate, don't judge, don't talk about your own troubles. It's fine to talk about a shared experience, but focus more on the individual that's in distress. Don't give false promises, and also don't be too negative. So I'll now pass you back over to Marco.
What we're going to talk about now is who might be more vulnerable. What we mean by that is really who can be affected more by the pandemic, and as we said, by the further exposure that you receive by being an healthcare worker. Something that we need to be clear about, in my opinion, is that when we talk about psychological resilience, we are not dividing the world, and so our colleagues, into who is resilient and who is not, who is mentally strong and who is not mentally strong. It's not at all like that. Psychological resilience depends from many different factors, and there are reasons why one person might be resilient to an event and might be less resilient to another event. So what do we really need to take into account then? If we cannot create groups, if we cannot create categories so easily, what do we look at? One way to look at this is using the knowledge that we have about our colleagues, especially the ones that we are responsible for. Do we know their baseline? And by that, I mean, do we know how they typically react to typical workload or increased workload or stressful situations or pressure? Do we know that? Do our colleagues can help us to know that? So are colleagues concerned, for instance, for some of their colleagues because of their behavior, because they're not typical for them, even when they are under pressure? So that's something to take into account. Are we seeing something that is consistently and persistently way above the baseline that we know for that person, and also their response under stress? We also need to consider that there is a number of things that we would not know during the pandemic. Our colleagues can be exposed to difficult family circumstances, financial pressure. They might have health anxieties we're not aware of. They might have previous psychological trauma and so on. So we might know these things if they let us know, and in that case, we try to empathically support them. But we might not know, because it might be that they don't want to disclose that, and it's their right not to do so. So when we come to looking for warning signs, it becomes maybe a little bit more complicated, in the sense that we could make a list of symptoms. We made some examples here that go from headaches, shaking, tiredness, loss of appetite, and so on. But we still have to take them into account within a context. So how do they apply for the person that we know? Again, how do they apply to their baseline? Someone who normally has higher levels of expressed emotion is different from someone who's not like that, and maybe is expressing higher levels of emotions than usual. There are some signs that we need to be more responsive to, and especially when it comes to things like suicidal thoughts, for instance. Suicidal thoughts should be always taken seriously. However, the person might help us understanding that although it is distressing and although they might need help, they are not actually actively planning to do anything with those thoughts. It's more the distress of carrying the thoughts. However, when suicidal thoughts are not fleeting, there's suicidal intent, which is clear, or there is intent with a plan, this should raise concern. We should do something about it. The first port of call is always to encourage the person to take action. So to contact their GP, to seek help, and other things that can be helpful in that situation. However, if the person is not able to do so, we can and we must override confidentiality, and we need to take action. That might be informing the GP, for instance. It's better when we can to support motivation for our colleagues to seek help, because, as I mentioned before, healthcare workers are particularly reluctant compared to other groups to receive help, and it can be linked to different factors. It could be linked to feeling guilt about getting help, or feeling shame. There might be a tendency to find it easier to give help than to receive help. However, if we engage in a conversation with them, if we share with them some of the principles that we've been talking in this video about, for instance, it might be that we can encourage their motivation. The other aspect that is often coming up during a pandemic is the one in relation to reaction to traumatic events. Healthcare workers can witness very traumatic events. They can see people dying, they can see many people dying, sometimes in the same day. There can be quite a lot of exposure to highly distressing and traumatic events. What is important to take into account is that typically, when we are exposed to traumatic event, we tend to recover naturally. And by naturally, I mean having, for instance, a network of people that is supportive. However, when that is not the case, usually after a few weeks, we see that some of the signs of distress, like intrusive thoughts, like nightmares or sleeping problems, are still there. Usually when that happens for a few weeks, beyond 1 month, between 1 and 3 months, it might be that the person might need professional help. So when to take immediate action? Quite simply, when people have serious life-threatening injuries, need emergency medical care, when people are so upset they cannot take care of themselves or their children, when people may hurt themselves, when people may hurt others. One thing that you can do is trying to reassure the person. This slide is from the World Health Organization manual for psychological first aiders that can be downloaded from their website. And here you see a simple exercise to try to reassure someone. And in the second part here, you will see something that is like a grounding exercise that can help people when are experiencing things like shock or dissociation or flashbacks about what they lived. If you want, you can press pause here if you want to read this more carefully. This is a table that is from the NHS Education for Scotland. They put together a very helpful package for psychological first aid as well that can be accessed on the website. Here you will see a description using the green, amber, and red classification of how we can monitor physical, psychological, social well-being in our colleagues to see if things are improving or are escalating. Again, I would invite you to press pause and look at this table carefully if you want to see some examples of that. Psychological first aid is mainly and mostly about informing and normalizing. So giving people information, helping them to get the right information, and normalizing their reactions. I think in a nutshell, this is what I would like anyone that is trying to understand psychological first aid take away from any training session. Getting information, giving information, normalizing the responses to a very atypical event. So summing up, what we discussed in this video was about how we get prepared to support colleagues in a pandemic, the principles of psychological first aid, look, listen, and link, where we're going to try to help. So is it about basic needs or information or support and so on? When, which phase we're in, preparation, active recovery phase, who might be more vulnerable, what to look for, and what to do. There's a number of resources that are available online. Here we have listed some. It's difficult to talk about them all, but with the help of Amber and Georgina, maybe we'll try to say something about this.
Yeah, so there are many useful apps and websites that you can access to manage your own mental health. So some of these include things like Mindshift, Headspace, the Calm app, and they all work through techniques of meditation and mindfulness. There's also a specific app for COVID-19. I think it's called the COVID Coach. I think Georgina can speak a little bit more about it because she's downloaded it.
I have, yeah. So I had a look at the COVID Coach and I found it really useful, so I've kept it. So it's aimed to manage the symptoms of PTSD. So it uses a variety of different techniques, some based on like mindfulness and grounding, but also thought shifting, positive imagery. And it's got a place for you to be able to like set goals over time and also track your well-being over time, which is really helpful. So I definitely recommend it as it's pretty comprehensive.
Yeah, it's not listed here, but basically it's called COVID Coach. It can be found on Google Store or Apple Store. It's free. And I think the icon is like a sun, like a orange sun or something like that. And Yeah, and still, I think for some time we still have some of the apps that would be free for NHS workers. So that's an opportunity to take if for whom is working in the NHS. But there are plenty of other apps that can be used even if people are not working for the NHS, like the COVID coach is one, for instance, that's accessible to everybody. So I think we've reached the end of this video. So thank you very much for watching this and for being with us. And thank you for watching this video again.
Thank you.
Thank you.